Medicare Advantage Part C and Part D explained insurance exam prep. Question 1. Medicare Part C is also known as Medicare Supplement, Medicare Advantage, Original Medicare, Prescription Drug Plan. Part C is the Medicare Advantage program, offered by private insurers approved by Medicare. Question 2. To enroll in a Medicare Advantage plan, an individual must be enrolled in Part A only, Part B only, both Part A and Part B, Part D. Enrollment in both Part A and Part B is required to join a Part C plan. Question 3. When enrolled in a Medicare Advantage plan, how are services covered? Through Original Medicare directly, through the Private Advantage plan, through Medicaid, through an employer group plan. The private Medicare Advantage plan manages and pays for covered health services instead of Original Medicare. Question 4. What does Medicare Part D cover? Hospital stays, physician services, prescription drugs, long-term care. Part D provides prescription drug coverage. Question 5. Medicare Part D is provided by the federal government directly, state Medicaid agencies, private insurance companies approved by Medicare, local pharmacies. Part D plans, PDPs, are offered by private companies approved by Medicare. Question 6. The coverage gap in Medicare Part D is commonly referred to as the black hole, donut hole, gap phase, deductible zone. The donut hole is a coverage gap where the beneficiary pays a higher percentage of prescription drug costs until catastrophic coverage begins. Question 7. Most Medicare Advantage plans are structured as HMOs or PPOs, indemnity plans, Medigap plans, catastrophic plans. Part C plans typically operate as managed care networks like HMOs or PPOs. Question 8. Can a person have both a Medicare Advantage plan and a Medigap policy? Yes, it is common. No, it is illegal for an insurer to sell a Medigap policy to someone with an Advantage plan. Yes, but Medigap won't pay, only if the person is under 65. It is illegal to sell a Medigap policy to a person who is enrolled in a Medicare Advantage plan. Question 9. In Part D, what phase follows the donut hole? Initial coverage phase, deductible phase, catastrophic coverage phase, premium phase. Once the out-of-pocket spending limit is reached, catastrophic coverage begins, drastically lowering drug costs. Question 10. The list of prescription drugs covered by a Part D plan is called a pharmacy directory, drug register, formulary, Rx index. A formulary is a tiered list of prescription drugs covered by a specific plan. Question 11. What happens if a person delays enrolling in Part D and has no creditable coverage? They cannot ever enroll. They face a late enrollment penalty permanently added to their premium. They must pay out of pocket for 1 year. They lose Part B coverage. A permanent late enrollment penalty is applied for every month they lacked creditable coverage. Question 12. Medicare SNPs are a type of Part C plan designed for anyone turning 65, people with specific diseases or characteristics, children under 18, veterans only. SNPs limit enrollment to people with specific severe or disabling chronic conditions, or those institutionalized/dual eligible. Question 13. Do people in Medicare Advantage still pay their Part B premium? No, Part C replaces it entirely. Yes, they must continue to pay the Part B premium, only if they want drug coverage. No, the government pays it. Beneficiaries must continue to pay their Part B premium, in addition to any Part C premium. Question 14. Medicare Advantage plans often include benefits not found in Original Medicare, such as hospital care, doctor visits, dental, vision, and hearing. Hospice care. Part C plans frequently offer extras like routine dental, vision, hearing, and fitness programs. Question 15. Individuals who qualify for both Medicare and Medicaid are known as double insured, dual eligible, joint beneficiaries, Medicaid Advantage members. Dual eligibles qualify for both programs and often enroll in dual eligible special needs plans, DSNPs. Question 16. Employer drug coverage that is as good as standard Part D is called equivalent coverage, creditable coverage, primary coverage, substitute coverage. Creditable coverage means it pays on average at least as much as standard Medicare drug coverage. Question 17. Drugs in a formulary are grouped into tiers. Typically, which tier has the lowest copayment? Tier 1, generic drugs. Tier 2, preferred brand name. Tier 3, non-preferred brand name. Tier 4, specialty drugs. Tier 1 generic drugs have the lowest copayments. Question 18. When can a beneficiary generally switch their Medicare Advantage plan? Any day of the year. During the annual election period, AEP. Only when they turn 65. Every 5 years. The AEP, October 15 to December 7, allows beneficiaries to switch Part C or Part D plans. Question 19. Original Medicare has no cap on out-of-pocket costs. Medicare Advantage plans also have no cap. Must have a maximum out-of-pocket (MOOP) limit. Cap costs at $50,000. Only cap drug costs. All Part C plans are required by law to have a yearly maximum out-of-pocket limit. Question 20. A Medicare Advantage plan that includes prescription drug coverage is called a PDP, MAPD, Medigap Rx, SNPD. And MAPD plan bundles medical and prescription drug coverage into one plan.